It's the morning after the bank holiday before, and at Baslow Health Centre, they're preparing for an avalanche.
It's a bit of a nervous day because we've been on bank holiday weekend and everyone gets very panicky. And sometimes they come along just to tell you they've been ill over the weekend and they're feeling better now.
It doesn't help that the computers seem to have taken a holiday too.
Touchscreen's not working. Not sure if it's because there's been new computers installed.
I just literally clicked on it once and it deleted the appointment.
And that they're 2 doctors down.
He's not in today, he won't be back till Thursday.
I've got one at 9:20.
Well, you've heard the phone. The phone's has not stopped ringing. It's always the same after a bank holiday. It's mad.
This is life on the front line of primary care in rural Derbyshire.
Things can only get better, as they say. I see you've had the stitches out.
Yes, last Thursday, she's out and she's just I haven't had another dressing on since.
The pressure's really on. You come in thinking, how am I going to get through today? No shortness of breath?
Slightly, now and then.
You know that the patients are still expecting to be seen every 10 minutes. You're worried about the pressure of time, but you're also really worried you're going to miss that one really important thing.
After morning surgery, Dr. Louise Jordan spends most afternoons visiting people who are housebound or in hospital. Today, she's facing a difficult conversation.
We're going to see John Ellis, who is a retired physicist who developed some very vague symptoms last year, which very sadly have turned out to be due to a neurological disease called corticobasal degeneration. His intellect is completely unaffected.
John can now only communicate via a tablet computer. He has to decide whether to have an operation so he can be fed directly into his stomach through something called a peg.
Last week you were having difficulty with swallowing and you made the decision that you would like to have a peg for feeding. They'll give you some sedation and they'll have to pop a little tube down your throat into your stomach and make a little nick on your stomach they'll pull it out.
John understood that putting a peg in was not a treatment. It wasn't going to alter the course of his disease. It would keep him alive while his disease progressed and his ability to communicate reduced. And he could see himself in a nightmare situation where he had no form of communication and was being kept alive. And that was something he vehemently didn't want.
You're not looking so happy about it now.
Back at the surgery, practice staff are still having computer problems.
They've updated to Windows 8, 7 or 8, and everything's changed.
Up popped these things I didn't want to pop up, which was a lady jiggling her bits at me and being invited to talk to single Russian ladies. I'm sure they're very nice, but I don't speak Russian.
Practice manager Carl Rex has got another reason to be unhappy. He's sifting through the results of a questionnaire sent out after the latest meeting of the patient participation group. The surgery's already tried extended hours, but patients in the survey are asking for weekends too.
The GPs and the nurses are dealing with patients that do come 20, 30 minutes late, and they accommodate them.
They're asking for us to provide 24/7 care, are they?
Yeah.
Do they understand if that happens they wouldn't get to see their own doctor?
It's not, is it? It's just a tick box there from the tick.
Okay, how have you been?
All right, I've improved slightly.
NHS changes mean GPs can make more decisions locally about how money is spent, but they're supposed to take patient views on board. It's Carl's job to balance the books.
Surveys indicating they are very happy, but what they don't understand is all the knock-on implications.
I absolutely loathe the extended hours we're doing on the Monday at the moment. And I actually had somebody come in at 7:30 in the morning on Monday complaining that he had to get an appointment so early to see me. I'm having trouble getting a good reading, but your blood pressure feels quite on the low side.
I either get the GPs to work more hours during the week or we reduce the time during the week. There's also a cost implications because staffing working on the Saturdays, and therefore can we afford all the services? Can we afford to have the appointments on a Saturday and the dispensary run at the same time?
The waiting room's filling up. Across the country, average patient visits per year have doubled in a decade. That's partly down to demographics. At Baslow, 1 in 3 of their patients is now over 65.
I went down like a sack. I mean, I could hear me go thump.
At 81, Louise's patient Roy Hattersley is firmly in that age bracket. The former Labour Party deputy leader is back home in Derbyshire after a tumble outside the House of Lords.
Louise is a marvellous GP. She's a devoted GP and she's a hard-working GP.
Your blood pressure's fine and your pulse is fine, so I don't think there's any need at all for us to fret about that from a cardiac point of view, okay?
I mean, I've no pain at all now.
So what does he think of the changes facing family doctors?
I wonder whether doctors want to spend their time being amateur accountants or whether they want to go on being doctors. I hope they want to be doctors rather than amateur accountants.
It's a week since Louise's last visit to John Ellis. He's been talking things through with his wife and now wants to revisit the idea of being tube-fed. When Louise walks through the door, John has a surprise for them both.
Today, I decided not to have a pet.
Right. So that's a bit of a change again, isn't it?
We've always said throughout our lives we wouldn't have anything to prolong it.
Yes.
Well, it's been quite difficult lately because of the communication problems. That's why I've had to be really sure of what his feelings are and what he wants.
I felt for his wife huge relief because I know she was incredibly concerned. I just felt I could hardly feel more respect for him. I thought he was an amazing man. I thought that was a really brave decision to make, and he must have been in torture in the 24 hours running up to that.
It's a very difficult decision, but it's his decision, and he knew that I would support him whichever decision he made.
Hello.
Over the next 3 weeks, John's condition deteriorates rapidly. When we next visit, he can only communicate by blinking.
My priority absolutely is his comfort. I want him to be peaceful and pain-free, so it's a physical and an emotional thing. Have you got any pain at the moment? All right, so you're saying yes, you have got pain. When I first got there this afternoon, he was having horrible, painful muscle spasms and was able to tell me with his blinks that they were still painful, but it was better than it was this morning. And I've got medication to get rid of the spasms, but the quid pro quo is it was going to cause some sedation, and I know that this morning that was a concern for him. It's really sad, but I think he's very much in the terminal phase now.
6 days after we filmed, John died, peacefully and at home as he wanted.
I think there really is something called a good death. We seem these days to almost see death as a failure, whereas actually we're all going to die, and my role as a general practitioner, when someone is going to die, is to be on that journey with them, and that involves the whole family. I have considerable concerns about the future in general practice. There is a big desire to try and get rid of the small practices because it's much more cost efficient to have large practices. But you'll lose with that the knowledge that goes with that and the understanding and that really bespoke way of managing individual patients. I will grieve if that happens.